All right, well done, everyone. So this is Vic from vicnclexprep.com. All right, so walk with me through this Nclex question. All right, let's go. So, a client with acute asthma exacerbation has received 3 back-to-back nebulized albuterol treatments. The nurse reassesses before the provider's next order. Which finding would the nurse attribute to the albuterol and report or act on? Select all that apply. So we have A, heart rate decrease from 128 to 92 beat per minute. Then we have B, fine tremor of the hand. C, serum potassium of 6.1 millimole per liter. D, blood glucose of 168 milligram per day in a non-diabetic. And E, we have pupillary constriction meiosis. F, we have a palpitation with reported anxiety and jitteriness. And then G, we have respiratory rate decrease from 32 to 22 with improving wheezing. All right, so let's go back to the question right now. We have a client that is having asthma, acute exacerbation of asthma. In acute exacerbation of asthma, we usually use the long-term medication, right? So we don't usually use short-term medications. We use short-term medications. Sorry about that. We don't use the long-term. The maintenance drugs are the inhaled steroid and then your tiotropium with salmeterol and the rest of them. But ipratropium, then albuterol, and or your oral or the IV steroid, they are for acute exacerbation. So here they're testing us on albuterol. So we want to know those side effects. That's what I want to ask. Or it's asking us which finding would the nurse attribute to the albuterol and report. So this is testing us side effect of albuterol. Now, you need to know the mechanism of action of albuterol. Albuterol is a beta-2 agonist, right? So remember we have 2 betas, right? Beta 1, 1 for 1 lungs, and beta 2, 2 for 2 heart. Beta 1, sorry, beta 1, 1 for 1 heart, and beta 2, 2 for 2 lungs, right? So beta 2 is found in the lungs, and then when we block beta 2 in the lungs, it leads to bronchial constriction with increased mucus production. But when we activate beta 2 in the lungs, it brings about bronchial dilatation, thereby we are having those oxygen flowing into the lungs, right? Now, when we look at albuterol, albuterol is a beta agonist. And then if you know your beta receptors, you know one of the neurotransmitters that activate that beta receptors is the what? Is the epinephrine or the non-epinephrine, right? And that is your sympathetic nervous system. So when we activate the beta receptors, we are activating the sympathetic nervous system. So since albuterol is a beta 2 agonist, so albuterol is going to activate the sympathetic nervous system. So when we are having side effects or toxic effects of albuterol, we are expecting those side effects or signs we are going to see in activation of the sympathetic nervous system. So let's walk through the option. So we know when we activate the sympathetic nervous system in the heart, it's going to bring about increase in heart rate and increase in blood pressure, right? So that is what albuterol is going to cause. So here we're having a heart rate decrease from 128 to 192. So this is not attributed to beta receptor. That is sympathetic nervous system activation. So I'm not going to choose A. So A is not part of it. Now, B says fine tremor of the hand. Yes, when we activate the beta receptors, you're going to see fine tremor. That is activation of the sympathetic nervous system is going to lead to fine tremor. So I'm going to choose that. Then C says serum potassium level of 6.1 millimole per liter. Now, take note. Remember, when we have hyperkalemia, I used to teach this on renal. When we have hyperkalemia, Nclex can tell you ways you can manage that hyperkalemia. Hyperkalemia is a situation where your potassium level is way high, greater than 5.0, because normal potassium level ranges from 3.5 to 5.0, right? So when we want to manage hyperkalemia on the Nclex exam, or the Nclex as I used to say, so what we're going to do is the first thing we want to do is want to stabilize the heart membrane, and what we can do is by giving a calcium gluconate. That's what it's going to do. It increases, or it kind of potentiates the heart and increases that threshold. Instead of that 5.0 causing toxic level or arrhythmia, it can elevate it up to like 10 before we start having arrhythmia. That is how it protects the heart, right? So calcium gluconate, then we can now shift the potassium into the cell, and we can do this as quickly as possible by using insulin and dextrose, right? And then we can also use Kzelate. Kzelate helps to excrete it through the GI system. Kzelate is your sodium polystyrene. And another way you can also shift potassium into the cell is by using albuterol. Take note. So one side effect of albuterol is that it can shift potassium into the cell. So if it's shifting potassium from the extracellular to the intracellular, it's going to lead to hypokalemia. So in this scenario here, one of the side effects is going to be hypo, not hyper. So we are having C is saying telling us hyper, so we are not going to choose C. So that is not part of the side effect, right? It's going to be hypo, not hyper. Now the next thing said blood glucose of 168 milligram per dl in non-diabetic. Are you following? Now you have to ask yourself, what is the normal sugar level in someone that is non-diabetic? It usually ranges from 70 gram per dl to milligram per dl to 110 milligram per dl. Some textbook can tell you 120 milligram per dl. So we're having 168. This is way high. We are having hyperglycemia here in someone that is non-diabetic. So albuterol can lead to that. Albuterol increases your sugar level, right? Apart from the sympathetic nervous system activation, albuterol also do that, because when you activate your sympathetic nervous system, what does it do? It's going to make your those sugar that is stored in your liver cells to be converted back, that is a glycogen, to be converted back to glucose and secreted into the blood, and this will elevate your sugar level. This is well known for sympathetic nervous system activation. That is how it works. Just imagine you entering, you're in a room and a lion comes in. What is going to happen is what? Your pupil will dilate so that more light can enter. You can be able to see the lion. Your GI system will stop working, sugar level will increase so that I can be able to get strength, so that I can be able to either challenge that lion or what, or run away from the lion. That's what I call it, the fight and flight mode. So albuterol activates your sympathetic nervous system. That's why it's a beta 2 agonist. So you're going to have hyperglycemia as a side effect. Now, pupil constriction, which is meiosis. No, albuterol will not cause this, because remember I told you, activation of the sympathetic nervous system is going to lead to what? Pupil dilatation. Because just imagine lion entered into a room, right? The flight and fight mode will be activated. Your pupil will enlarge so that more light can go inside. You can be able to see the lion. Is it that you're challenging that lion, or you're finding your way out of that room? You're running away from that lion, right? So that is it. So if you're not going to, this will not constrict, rather it will dilate. So I'm not going to choose that. Is not part of the side effect of albuterol. So the next one say palpitation we reported anxiety and drowsiness. Yes, remember we're going to have tachycardia. Definitely this is going to lead to that. So it's a side effect. And the last one say respiratory rate decreased from 32 to 22. This is good, but with improved wheezing. So this is not a side effect of albuterol. Rather, this is a therapeutic effect. So our answer that are peculiar to our side effect of albuterol we need to report or act on is going to be on fine tremor, blood sugar level that is 168 milligram per dl, palpitation, and that is our answer. So take note of this for the Nclex exam. So when you have albuterol side effect, you're looking at activation of the sympathetic nervous system. So just look at those options that look like that tells you that you're having activation of the sympathetic nervous system, or you can relate it to pheochromocytoma, because in pheochromocytoma the sympathetic nervous system is overworking due to what? Excessive catecholamine, that is the epinephrine and non-epinephrine are so high, right? So you're going to see all these side effects we have chosen, B, D, and the rest of them in pheochromocytoma with elevated blood pressure, because these are activation of the sympathetic nervous system. So it's very, very important for you to know this. I kind of used to tell my students, and I teach it very, very well in pharmacology, because most of the medications that Nclex asks you, you need to know them. The ones that are sympathomimetic or the one that are parasympathomimetic. It's very, very important on the Nclex exam. When you're looking at the sympathomimetic, you're looking at oxybutynin and the totredine and the rest of them, right? Then when you're looking at parasympathomimetic, you're looking at those medications we use in the management of a myasthenia gravis, right? Galantamine, pyridostigmine, neostigmine, and the rest of them. Donepezil, right? They elevate your acetylcholine level, because acetylcholine is a primary neurotransmitter that is responsible for activating the cholinergic receptor, which will activate your the parasympathetic nervous system. So the parasympathetic and the sympathetic are made are what the autonomic nervous system, and they work in opposition. So when the para does this, the sympathetic does the opposite of this. So take note, albuterol is a beta-2 agonist. So when we activate it, excessive activation of that beta-2 agonist is going to lead to overactivation or stimulating the sympathetic nervous system. So you pick the options that look like that are activating or side effects of your sympathetic nervous system. So that is it, and that is our answer. All right, so this is Vic-Nclex prep consult. So we run our Nclex Academy. So we do the classes Monday to Thursdays by 10 p.m. West African time. If you want to join us, you can go to our website www.vicnclexprep.com, fill our contact form, exercise patients, someone is going to reach out to you, right? So to get more on this kind of practices, log on to our website and then click on Get Started, subscribe, and then your way in passing your Nclex exam. So this is where we're going to be wrapping up today for our Nclex review. Do have a lovely day. This is Vic from Vic-Nclex. Thank you. Bye.